Hi, my name is Deanna Wall, and I am a mom of a 26-year-old son that has special healthcare needs and has autism. And it's been a privilege to be his mom, as I've learned a lot of things in my life. And I also currently work full-time at the Utah Parent Center. Luke was on the wait list, gosh, it's also fuzzed. I want to say over 7 years is how long he was on the wait list. So, and it did take some time, and there was a lot of trauma in between until you got funded. So Luke actually has a diagnosis of tuberous sclerosis, and with tuberous sclerosis, the dark side of tuberous sclerosis is the violent, aggressive behaviors that happen with that. We were waiting for help and assistance in terms of respite care, caregiving, behavioral services, so many different things. It was extremely exhausting trying to parent a child with complex needs, but and also having other children. So there's traumas that kind of happen in those settings within the home setting. For instance, he'd push me backwards down the stairs, or he would, hit me maybe 20 times a day. So it was really hard. We had windows that were being broken, holes in the walls, doors that were busted from the frame. The psychiatrist did recommend that I call 911 a few times to just help him realize that there's consequences. That wasn't super helpful, although I think it made a connection. But after 3 times, the police told me to not call again, or they will take him away. We had insurance, but all of the medications and all of the doctor's appointments, because my son's involvement involves every organ system in his body with his disease, it was thousands of dollars a month between medications, co-pays, medical appointments, things that weren't being covered. So it was a lot of money, but it's what we did. We did our very, very best. At the very beginning, we got a grant from DSPD for $800, and I walked out back in the day to the mailbox and opened that up, and I just cried thinking that someone wanted to help me. I don't have family to assist. My parents have all deceased, and there's really no one to help. So I was really struck that someone even wanted to help. It was $800, but when you get that grant, you want to demonstrate to the state that you can utilize that funding and to have it improve your lives. Then regular funding will come later through DSPD, which came the next year later. And the funding from DSPD is needs-based, so it's always at the beginning based on the needs. So a lot of that was respite care services, and I would hire different young men to come into the home to spend time with my son and to help him feel productive out in the community. And we did a lot of socialization and tons of building skills with those respite care workers, and it was really a gift. So when it came time that we needed residential services, we were not getting approved for that. And we had a couple different psychiatric stays, and my son wanted to stab us. And he wanted to hurt us, and particularly me as the primary caregiver. We slept every night with a mattress over our bedroom double doors. We slept with a mattress over those doors, bungee corded, for a couple years because he articulated that he wanted to stab us while we were sleeping at night. So we lived like that for several years, very nervous, and it was very crippling in terms of how you can function in your daily life as adults to care for your family, and to process what you're going through. Eventually there was another psychiatric stay at the hospital, and we had applied for residential housing for Luke. so that he could be safe and we could be safe. And we were denied 2 different times for that. So finally, the 3rd time, I wrote a letter to the state of Utah, letting them know that he was homeless and that he would not be able to come back to our home after that hospital stay. And we were finally funded at that point in time. Even though we had DSPD services, we were finally funded for the residential piece of it, for Luke to have housing. And it was a really difficult thing to do, and something I feel a lot of shame for and a lot of guilt, because, it's just hard. It's really hard. So many things are different having the services that you need. So my son is thriving. There was a tremendous codependence between him and I would trigger him with task demands or asking him to do things or things like that. And then he'd kind of trigger me where I would kind of shut down. But now that he has his own place to live that is safe, he at first was in a group home, but now he's in a host home, which is much natural for us coming from the loving family, that setting that we had. He's thriving in the host home environment. But my son has learned how to be in the community, how to have a job, how to be independent. He can ride the bus places and to go places that he needs to. He has actually learned how to read because he's motivated and wants to read the ESPN apps and things that a normal young adult would be interested in. We see Luke several times a week, but he is safe. We are safe. And I now work full-time for the Utah Parent Center. And I go from home to home helping families that are on the DSPD wait list. And that has helped heal me with kind of the trauma and the things that you go through, because often you don't get funded until it's crisis time. And it takes years to recover from crisis. And it's rewarding helping other families that are out there because it's tough. It's tough, and the things that you see when you go in these homes are no way that any families should have to live. It's shameful that in the United States people live like this. I feel like I'm getting out of crisis with my husband and myself. We are now empty nesters. All of our kids are raised, and we, just even things like, cleaning out closets and taking care of things that just normal people take care of. I feel like we're finally adulting.